welcome aboard to Martini Mornings on Mooooooood Radio. A fabulous doctor doing wonderful things with the MacCallum Cancer Centre. Now, MacCallum's Cancer Centre is Australia's only public hospital solely dedicated to cancer. In 2019-2020, Peter Mac provided more than 100,000 radiotherapy treatment sessions for more than 7,500 patients. It's Victoria's only provider of specialist radiation treatment services for children, and they are looking for new ways to make this less traumatic. So the best person to talk to is Dr. Nigel Anderson, who is now in a research capacity for Peter MacCallum Cancer Centre. Welcome aboard, Nigel. Thank you for joining us.
Thanks for having me, Martine. Chat.
And it's wonderful that you're based down in Victoria. That's correct.
Correct, yeah, down in Melbourne. So
yeah.
Max, as you said, it's a big place, and we've got 5 sites spread across Victoria.
Wow.
The major site is in the city, or very close to, and we have some metropolitan and also a regional site out in Bendigo, which is about sort of 2 hours north of Melbourne. So yeah, it's a big centre.
How fabulous. Now, when you got into your speciality, which is?
Well, in this particular, what we're talking about today is paediatric radiation therapy, the use of virtual reality in trying to educate our patients about their treatment to try and, I guess, reduce some anxiety and improve their health literacy or their understanding of what's going to happen for their treatment. So that's where this particular study has come from. But I guess this has been while I've been at Peter Mac for the last 5 years. As you said, Peter Mac's very much the only centre in Victoria that treats paediatric patients. So until you actually work at Peter Mac, you don't really, I guess, get immersed in that paediatric bubble. So, but now I've been fortunate enough to work in the study for the last few years and have seen some good and some bad things. Obviously, working with children in radiotherapy, but I think this particular study is a great example of the work, not just in this study, but also some of the other initiatives we're doing at our hospital and try and improve the experience for our kids that come through, obviously being a very, very challenging time.
So what kind of conditions are you treating in kids?
Yep, so we do all types of cancers. So we can be anything up in the brain cancers, we can do sarcomas, this whole variety in all parts of the body. We're treating with radiotherapy. Radiotherapy, as you're probably aware, is a type of treatment where it's very localised, so it treats directly the location of the tumour, as opposed to, say, chemotherapy, where it treats systemically or the entire body. So we treat very localised areas. So in particular, this study was focused on probably more so children that have tumours in their brain or sort of above the shoulders where they require a mask to stabilise them for their treatment. And that obviously can be a very confronting experience for anyone, not just a child. So,
absolutely.
So we've done a lot of work in, I guess, trying to prepare them for that experience, being as challenging as it is, so that when they do come to the real time or the real treatment, that they're actually hopefully more aware of what's going to happen. So then can actually get them through that without the need for general anaesthesia as well, which is quite often used in our younger patients.
That's amazing. I guess as a parent, the whole concept is so scary, and it would be for our youngsters as well. And I guess you're dealing with children who are non-verbal, who are unable to explain what they're going to be going through, and so you do have to use general anaesthesia, which then has its own problems and complications in not only their treatment but their general health as well.
Yeah, it can. So obviously the very young patients are still, it's particularly difficult to get them through without general anaesthesia, but our particular study focused on children from 6 to 18, so quite a large range of those, and many of them were still coming in. They were outpatients. They were actually living. Some of them were still going to school and doing all those things that kids do. So, but to be able to make that treatment as normal as possible, and some of them, I guess, most of them were in a position where they were able to understand what they were going through. So to be able to give them the opportunity to better process what's going to happen for their treatment, is what virtual reality enables us to do. It enables us to immerse them in what's going to happen.
That's amazing. Absolutely.
We just touched on parents as well. I think the parents is something that we've also, as part of our study, looked at trying to improve their understanding of what's going to happen too. Because I'm a parent myself as well, and I thought of my children going through something like that. It's frightening, probably more frightening for the parents.
And to allay some of the parents' fears, of course, that then rubs off on the child as well. If a child knows or can feel that the parent is feeling more comfortable, then essentially is going to help the whole process as well. I can't imagine what it would be like for a child, Nigel. I went through recent radiotherapy treatment for breast cancer, and I'm telling you now, it's every day. It's sitting in the waiting room waiting. It's then getting changed into a gown. It's then waiting again in another waiting room. It's then being taken into the actual machine that you're then loaded onto and put into some very strange positions so that they can line you up. For lots of people like myself, we're tattooed where the beams are going to be. And then, Nigel, everyone runs from the room and you're left there. You're left there for a long time with your own thoughts, a very loud machine that moves around you. In my case, I'm semi-naked because it was my breast. The whole thing is exhausting, mentally exhausting, physically exhausting. And I remember I had 28 treatments, and I think I think number 19, I wept the whole way through. I had just had enough. And it was my technician, Luke, who came in and just held my hand and afterwards and just was there with me and just held my hand so I could get up the next morning and do it again. Now, I'm a 44-year-old woman and I'm a psychologist, and I've actually been through this before. This is my second time round with breast cancer. I can't imagine what it would be like for children who are having to front this scary situation every day. So how was your research? How did you research into what is the best ways to perhaps calm a child, explain to a child what is going on?
Yeah, well, our research in particular was focused on the use of virtual reality to educate patients prior to their treatment. So some of the things we looked at was their anxiety levels before they watched the virtual reality experience to then afterwards. And also you'd be aware with the radiation process, it's a two-step process. So you have your simulation appointment where all the measurements are taken prior to the treatment occurring, usually 1 to 2 weeks afterwards. So we broke it up into 2 stages. We measured the anxiety, as I said, before watching the experience and afterwards. And we also did it in the parents as well, which, as I said, we think is particularly important. And we found in our study that after that first watching of the virtual reality, the actual anxiety levels of the children dropped. And also for the parents as well, which was really encouraging. What they're watching was actually, I guess, alleviating some of those unknowns or fears they may have had. And then we also got the children before they watched it to tell us what they thought was going to happen. So in terms of their understanding of their procedure, which you would understand, you get all this information, it can be quite daunting as to what's pertinent to me, what's right, what's wrong. You know, you can always jump on the internet these days. You can find anything you want, and a large percentage of that isn't actually relevant to what you were having done. So we wanted to really channel the information for the children. So what we found by taking it, what we call a baseline measurement of what their understanding was, and then watching it, and then getting the child to explain again afterwards what's going to happen, we saw a significant improvement in their health literacy as well. So their understanding of what's going to happen, which I think goes hand in hand with anxiety. That if you know what's going to happen, not just in radiotherapy, but generally most things in life, if you know what's going to happen, generally less anxious as a consequence of that. So we found that to be the case in this particular study as well. So I think it was all about preparation to getting the kids ready for their treatment. As you said, it's still going to happen every day. It's still going to be a pretty laborious process, and it does take its toll. As you said, you were a fraction 19 of your 28, and you've had enough.
Had enough. Yeah.
That's totally understandable. So, and as for kids, that's another layer again, because you also have their parents who might be stressed and adding to those anxieties as well. So,
well, you're taking time off school. Parents are taking time off work to take them to there. The whole process is just fatiguing and laborious. And then it's interesting we're talking about this. I was only chatting to someone this morning about talking about cancers and my own experience of cancer, in that when you are deemed NED, no evidence of disease, to sort of throw your arms up and have a party. But unfortunately, it still goes on. So for radiation treatment, for months after, I was dealing with burns, and still 18 months on, the changes to my chest is incredible. So it's not just dealing with the when they're coming in and they're on the machine. It's dealing with the weeks and the months and even years afterwards of the effects of this treatment.
Oh, sure. Depending on where the radiation is delivered, it does at times, not all the time, but at times it does come with what we call side effects in the acute setting or while it's actually happening, but also those ones that you can having to deal with for weeks, months, and in some cases years after the treatment. So, whilst it's a finite period of time that you have the treatment, it's not once the radiation switches off that it stops working and continues to work on the area that we want to treat, that being the tumour or the cancer cells, but also the sometimes, as you said, your skin or the normal tissue around it, where you're getting some complications from that afterwards as well. But I think the way we do radiotherapy these days is improved remarkably over the last, even 10. I've been working in this profession for about 15 years now, and the way it's improved over that time has been unbelievable.
Fabulous.
One of our big focuses is when we do the radiation is, whilst we want to treat the cancer, we also want to avoid treating the bits that don't need to be treated.
Yes.
And I think our ability to do that in recent times has been really improved. We've got technology now that enables us to do that a lot better than maybe what we were 15 years ago. So it's particularly important in children as well.
And it seems every year there's a new way of doing things or an improvement on doing things. And you guys at MacCallum Cancer Centre are pioneering that. So hats off to you in doing that. And it's, as you say, it's not just for the primary patient, it's for their parents. But I was also intrigued that you are making a superhero film for each child so that they can share that with not only siblings who are affected by this whole treatment scenario for their patient, but also that they could take to, say, school to explain to people what's going on in their lives. This is incredible. Can you tell us a bit more?
Sure. So one of my colleagues, Daniel Sapkowski, he's another radiation therapist who's got this unique audio-visual skill set, which is something that I don't have. And he creates these videos. We've had this program in place for Peter Mac for a number of years now, at least probably 5 or 6, maybe more, at least the whole time I've been there. And what it is, it's, as you described it, they make a video of the child's journey through their radiotherapy and edit the videos into superheroes. They get the kids dressed up. Quite often, actually, the videos involve their siblings as well, so they can get them involved in in the video as well. And they animate those. They do lightning strikes and all those superhero things. They can dress up as their favourite character. So that's only sort of one of many things we do. We also have the ability to paint their mask if they require.
Yes,
so we can turn them into a superhero. We've now got the bunker, which you were describing earlier, as the room where they have the treatment. We've got that lit up now in an audio-visual display.
Wow.
So a light show when walking into the room. So we try and make it as inviting and as friendly as possible, even though it is a course of radiation that can go up to sort of 6 weeks in length. We try and make each day as making, not necessarily wanting them to come back, but not making it as arduous.
Absolutely, yeah. Look, it's on every cancer patient's lips. Can we transfer some of this into the adult treatment centres? I would like a mask. I want a superhero movie as well, Nigel. I think that would have.
Definitely. I think we can. We're doing some work. If particular, maybe not the mask so much, but more the virtual reality thing. And as I said earlier, the kids aren't the only ones who get anxious with this treatment. Like adults getting a mask. I've seen some of the earliest, toughest looking men come in for their radiotherapy and you think they'll be fine. And then you put a mask on and they freeze and they're terrified by it. Which,
right.
It's equally important. So I think we're doing some work in potentially looking at virtual reality in other settings as well, not just the paediatric setting. That was the obvious
I love that. Yes, yeah.
So we're looking on the back of what we've done now, we've been expanding this to other patient groups as well, because we all know that the patient experience is important for everyone, and everyone has different.
The impacts on treatment outcomes is incredible. I'm wondering with the headset. So it's a headset you've got on, and what are they actually seeing? What is the VR experience that they're getting?
So we made the videos. It goes for about 5 minutes. We're mindful with the children that not to make it too long so they don't lose their concentration. But what they're seeing on that experience is part of it is watching a boy. I think he was a 12-year-old boy at the time. So we tried to find someone in the middle ground to cover all age groups. We watched him have the treatment first, but then it switched to having the camera underneath the mask, so the children were lying there like they had the mask on and they were having the treatment, so they could see the machine moving around. They could hear all the noises. We had it so that the machine was running and the radiation was being turned on. As you described, there was a lot of loud noises and the machine moving around. So we had it so that they even got them to lie down as if they were having their treatment as well. So we tried to simulate it as much as possible so that when the time comes to have the treatment, it wasn't as new an experience as what it was.
Yeah. So from a psychological point of view, you were habituating them and you're also cueing them as well, which is, absolutely integral to doing that. Nigel, thank you so much for letting us know just one aspect of the great stuff that you and Peter MacCallum Cancer Centre are doing for patients that not only in Victoria, but I mean, this is, we talk about trickle effect. This is going to be fabulous throughout Australia and the world. It's groundbreaking stuff. But as a mum and a cancer patient myself, I thank you from the bottom of my heart for putting in the effort and time to make this a better experience for everyone, as a parent, as a patient, siblings, schools, because unfortunately cancer is affecting so many of us. What are the horrible statistics with kids?
The kids, obviously it varies on the diagnosis of what they have, but the numbers are pretty good for children. So we have as an aside to that, we have a clinic at MacCallum Cancer Centre where children are coming back who've had radiation therapy many, many years ago. So that's why we have to be mindful in how we deliver our radiation, because whilst we want to treat the cancer, we don't want to, increase risk of where we can avoid it for the effects of radiation down the track as well. So, and that's why the children are a little bit different, I guess, in the way we treat them. There's so many extra things we need to consider when we do their treatment to make sure that they're going to be living for long periods of time after their treatment, because most of them have a really good prognosis. So we want to make sure that we're not creating problems down the track if we can at all avoid. So that's very much a focus of radiation therapy and paediatric setting, to make sure we give them the best chance to be able to, in terms of developmental, in terms of giving radiation to, say, areas of the brain which may cause cognitive impacts down the line, or it might mean giving radiation where we don't need to in, say, certain vertebra or growth plates which might compromise growth.
Yes, of course.
When you compare that to, say, treating an adult where most of all the development generally has occurred, there's so many more things we need to consider.
Yeah, absolutely. Nigel, we're so lucky to have you doing this for us, and so blessed to have the Peter MacCallum Cancer Centre doing amazing things, not just for kiddies, but for all of us. So thank you for your time. We're going to let you get back to it, and so you can get back on some research horses and make this a better experience for everyone. And look, I hope one day we don't have to chat.
Yes, for sure. No. Just want to, before we finish up, Martini, I just want to mention it's very much a team effort. I'm obviously doing the interview today, but there's so many people who have been involved in this process. We're fortunate to work where we do in in an area where there's a big medical precinct. So we did this study with a research institute up the road called the Murdoch Children's Research Institute.
Yes.
The psychology expertise to this project and some of the VR, some of the preliminary work they've done. So we work with them at Peter Mac. It's very much a team effort. So whilst I might be the face of this now, there's many people behind the scenes that have contributed to getting this up and running. And now that we've done our study, we're using it, on our patients. It's sort of the standard of care now, which is really exciting. So it's very much a team effort. So again, thanks again for the chance to chat today.
Yes, really fabulous work. We can't wait to chat with you again and hear what fabulous innovations you have in cancer treatment and really helping our experience of that. Thank you so much, Nigel, of the Peter MacCallum Cancer Centre.
Thanks, Martine.